Hi, and welcome to this module on Lifestyle Medicine 101 for Leaders. My name is Rahul Anand, and I'm going to walk you through the why, the what, and the how of lifestyle medicine in this module. So, these are our objectives. One, analyze the importance of self care for leaders and link meaning and purpose to self care. Second, conduct a lifestyle self assessment. Third, define lifestyle medicine and the six pillars of lifestyle medicine and list the most important recommendations in each pillar. And fourth, apply the SMART goal setting framework for implementing lifestyle change. So let's start with the why question. Why care about self care? And I'm going to share with you the story of my father, who was a banker back in the early 80s in India, and he was in his early 30s and got posted from India to Uganda, Africa, in the middle of an ongoing dictatorship and civil war there. So when he got there, there was really no Indian grocery or much of fresh fruits or vegetables that he could have access to. And he would go get his grocery once a month from the neighboring country, Kenya, and buy whatever could last the month without getting spoiled. So a lot of ultra processed food there that he had grown up eating. He was sedentary, and even if he wanted to go, it was quite unsafe to go outside at odd hours with the civil war going on. He would sleep poorly. Often there would be the sound of gunshots there at night. He was away from all family for the first couple of years there. And then, even after me and my mom joined him there, he was still away from the rest of his family for a total of 4 years. And there was a lot of stress in every day without many outlets to relax or de stress. And somewhere along the line, he picked up chain smoking to relieve his stress and to get through his day. As time went by, as the months went by, as the years went by, every year he would need a new set of clothes because the old ones, the old trousers, were too tight at the waist and they wouldn't even fit him. And this went on for 4 years. And shortly after he returned home to India, barely 37 years of age, one typical morning as he was rushing out to work, running out, trying to get there on time, he noticed a sharp, severe chest pain, like an elephant sitting on his chest. And each breath was a losing battle to get oxygen into his struggling body. There was no 911 to call at that time, and somehow he drove himself to the hospital and made his way into the emergency room, where he found out that he was having a massive heart attack. Not only that, he was diagnosed with type 2 diabetes along with the obesity, and these things were probably there in the background, undiagnosed, and leading to this moment. After this day and episode, life changed for him and for us. But once he recovered and he was able to go and push himself again, some of the old habits returned. He continued to smoke, be sedentary, sleep too little, and drown in stress. And another 12 years went by with a slow decline, and ultimately a day came when he could not even walk a few steps without gasping for breath. He couldn't sleep through the night because lying flat meant that all the blood collected in his lungs and would wake him up after a few hours. It was at this point that it finally registered on him that life could not go on like this. He visited with a heart specialist and found out he needed a heart bypass at this stage. And he went through with it. Luckily, he made it through it. And he was a changed man after this episode. After this, I rarely saw him eat food that was made outside our home. He started taking walks every morning. He switched jobs so he was able to get enough sleep and manage the stress. Spent much more time with family, especially my mother, and never touched tobacco again. Like all of us, he still had his flaws, and although belatedly, some of the pillars of lifestyle medicine that he found were finally helping him rebuild his life again. On one hand, I was very lucky that he survived this heart attack and lived till 74. On the other hand, insight and action came too late for him, and He said many times that had he known the pain he would have had to go through from this heart surgery and the disability from the heart disease and diabetes, that meant he couldn't do many of the things that mattered so much to him, he would have done things very differently earlier in his life. One of the reasons I went into medicine is because of him, and it is my hope that listening to his story makes you consider if something like this could happen to you or your loved ones, and think about what you could do to prevent such an outcome. This infographic from the CDC and American College of Lifestyle Medicine shows that about 6 in every 10 people are sick with a chronic disease. 4 in 10 actually have more than one. Of all the people listening to this webinar, more than half are going to be struggling with their weight. 1 in 2 may end up with heart disease, 1 in 3 with prediabetes, 1 in 10 with type 2 diabetes. Now, despite all the spending in our healthcare system, people are still very sick. We need interventions that treat the root cause of this illness, not just band-aids for what's on the surface. Let's pause to consider for a fact how many people in America actually live a healthy lifestyle. This study from the Mayo Clinic looked at over 4,700 people and found out that less than 3% of Americans live a healthy lifestyle, as defined by 4 criteria that included exercise, diet, body fat percentage, and not smoking. Now that we've talked about the why of lifestyle medicine, let's talk about a couple of self-assessments that you can use to see where you stand. This is from the VA Whole Health Assessment, which we do for every single patient who comes into our practice. And after a holistic assessment of physical, mental, emotional, and overall well-being, this dives into the most important question. What do you live for? What matters to you? Why do you want to be healthy? This why is what drives everything that comes afterwards. A more granular way of finding out how are you doing is this very specific assessment developed by the American College of Lifestyle Medicine. So let's look at all the criteria one by one. In nutrition, are you having 5 or more servings daily of whole fruits or vegetables and limiting ultra-processed food to no more than 10% of your caloric intake? Are you active more than 150 minutes per week with moderate activity and more than 2 days a week of strength training? Are you sleeping an average of 7 to 9 hours at night? Do you have real supportive relationships and feel like your life has purpose or meaning? Do you feel like your stress levels are manageable and have 2-3 ways to relax? And are you not using any form of nicotine or recreational drugs and not exceeding safe limits for alcohol either daily or total weekly? That's less than 8 drinks a week and no binge drinking. So once you've looked at this granular assessment, you may wonder, what is the way ahead? What is lifestyle medicine? This is an evidence-based approach using lifestyle interventions to treat, reverse, and prevent chronic diseases. It addresses the root causes of chronic diseases to improve health and reduce costs. There are 6 pillars of lifestyle medicine, and each pillar acts in synergy with the other pillars to make the whole foundation stronger and prevent and reverse disease. The first is nutrition, a real whole food plant predominant diet. Restorative sleep is the second one. Regular physical activity, including aerobics and strength training. Avoiding harmful substance use. Managing stress, especially chronic stress. And building healthy relationships. These are the 6 core pillars of lifestyle medicine. Now we're going to look at each pillar one by one and go through what are the major recommendations and how you can make sense of them. The first pillar is nutrition, and the best advice on nutrition boils down to these 8 words. Eat real food, mostly plants, not too much. So, limiting ultra processed foods like fast foods, sugary drinks, packaged foods to no more than 10% of the total caloric intake on any day, even the worst day. Hopefully, none on the best days. Mostly plants, so 7 or more daily servings of vegetables, fruits, and legumes, along with whole grains and nuts in your daily diet. Each serving of vegetables and fruits has been shown to cut down risk of heart disease by 4%. An ounce of nuts in your daily diet has been shown to benefit all-cause mortality. One of the reasons these work is that there is soluble and insoluble fiber in real food, which both feeds the healthy microbiome in our gut and it gives us nutrition in a way that our body can handle. The third recommendation is to avoid addictive foods high in salt, added sugars, and saturated fat. Often processed foods are prepared to what is called bliss point by the food industry, which makes us consume them in excessive amounts. Another way to not eat too much is to drink plenty of water daily, including before each meal. Now, these are very simplistic recommendations, and one has to acknowledge that beyond these, there are many eating disorders that may need behavioral therapy and additional care beyond these simple things. This is an example of a food plate from the American College of Lifestyle Medicine, and it gives you an idea of a healthy plate with fruits and vegetables, whole grains, proteins, and adequate water intake. The next pillar is physical activity, and here the key recommendations are in aerobics, strength, and balance. So 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous activity weekly. And this activity of 150 plus minutes a week has been shown to cut down risk of dying by a good 20%, with additional benefit as you go higher. Strength training of 2 or more days each week is key to preventing muscle and bone strength decline, and balance training like yoga, tai chi, pilates, or other is recommended for adults more than 65 years of age. One way of thinking about prescribing exercise is the FIT mnemonic, which is the frequency, intensity, time, and type of exercise. For example, if we are talking about walking, then one can think of that as the type of activity. The frequency would be how many days of the week. So maybe you're picking walking 5 or more days of the week. The intensity is how hard you're working. So is it just a light stroll where you're chatting with someone? Is it a brisk walk where you can still talk, but you may not really be able to chat at leisure or sing? And the time, is it going to be 20 minutes, 30 minutes? So the length of time or duration that you're going to work. The next pillar is sleep. And here the biggest recommendation is getting 7 to 9 hours of sleep at night. Sleeping less than this increases the risk of dying early by about 12%. Additionally, 20 minutes or more of sunshine and physical activity earlier in the day, in the first half to 2/3 of the day, can help direct our internal clock to be able to have better sleep at night. And the third recommendation is to avoid caffeine after 2 p.m. and keep electronic devices out of your bedroom at night. So caffeine acts by blocking the adenosine receptors and has a half-life of 4 to 6 hours. So it needs adequate time to wash out of your system before you sleep. Similarly, blue light exposure from electronic devices like phones and laptops impairs sleep for a few hours. So it's important to stop getting this light exposure in the last couple of hours before you're going to be sleeping. The fourth pillar is social connection, and here both the number, so that's the sources of support, and the quality of relationships is important. The need for social connection is hardwired into us. We are social beings. We needed to be around other people who are supportive of us to survive as we went through evolution. And the quality of our relationships, even now, may determine a lot of our lifestyle behaviors. On the other hand, unhealthy social relationships, isolation, and loneliness, which is an epidemic at this point, are associated with increased mortality and morbidity. This is as big a risk as anything else on our list today. Some of the support for this being one of the most important pillars that determines how long we live and how good we live comes from this long term Harvard study that includes multiple generations of individuals followed for more than 80 years. So, one of the lessons from this study has been that it does matter the number of close relationships one has to well being. And this is a table that they have put out after reviewing the stories of these participants to share all the needs that these relationships fulfill in individuals' lives. So, this includes safety and security, learning and growth, emotional closeness and confiding, identity affirmation and shared experiences, intimacy, help, and fun and relaxation. Robin Dunbar, a British anthropologist and evolutionary psychologist, has done work that sheds light on the number of close relationships most people have, that is 4 to 6. And then there's a larger group of 150 to 200 people who we are loosely connected to that may fulfill some of these roles. As the saying goes, it takes a village and not just to raise a child. If you want to think about the relationships, especially the close relationships in your life, you can think of it and map it on these two dimensions of whether the relationship is energizing or depleting, and whether your interactions are infrequent or frequent. And this may give you some starting insights on the relationships in your life. The energizing relationships that are infrequent, you may want to have more frequently. And then the relationships that are really important to you, if they're on the depleting side of the scale, you don't want to take that at face value. Rather, you want to lean into that discomfort and think about where the opportunities lie to work on that relationship and move it on this curve. Some more granular help on building meaningful relationships comes from the book Connect, which is a favorite of our students. This is a book about building exceptional relationships with family, friends, and colleagues by David Bradford and Carol Robin from Stanford. Three of the big takeaways from this book, for me at least, one of them was to build relationships, one needs to build trust and be vulnerable. So that's the concept of 15% more sharing beyond your zone of comfort, and sharing not just what's happening, also the emotions that lie behind what's been happening. The second tool is learning to stay on your side of the net, especially when dealing with conflict or disagreement. So, talking about what happened or what you experienced and your feelings and your intentions, but not attributing motive across the net. So, not telling yourself a whole story about the other person, rather exploring the other side of the net with curiosity. And then the third tip is bringing up small pinches, so small disagreements, before they become major crunches. And the second and third tip relate to each other, because if we don't bring up small pinches, then we start telling ourselves this whole story about the other person, which builds up with every little pinch and in the end leads to either a big fight or to walking out. These are some of the interpersonal relationship competencies listed in the Connect book, that in an exceptional relationship, you can be fully yourself and so can the other person. You're both willing to be vulnerable. You build trust and do not use disclosures against the other person. You can be honest with each other. You deal with conflict productively, and you're both committed to each other's growth and development. You may want to look at these and think, which do you do really well? And what do you do that makes you good at this? And which competencies do you struggle with? And think about what holds you back. A lot of times it's fear of something. How can you grow? And once you've thought about this, then the next step is applying this to your relationships. So you can select two or three that you want to build and think, what are your goals in these relationships? And pick any one personal or professional relationship and get started. A third key concept to bring in is the Japanese concept of ikigai, which means a reason for being. And this is especially relevant to our workplace and our choice of what we do for our living. Ikigai, which is the sweet spot, in this lies at the sweet spot of what you love doing, what you're good at doing, what the world needs, and what you can be rewarded for. So you can look at this and it may help you center yourself as you think about what you love in your work, which gives you a reason for being. The next pillar to talk about is stress management. How are your stress levels? Are they at a level which is helpful to you, or are they at a level that is distressing for you? And then identifying the sources of stress, the good one that keeps you on track and motivated, and then the bad sources, especially chronic stress, that give you distress, and using tools to reduce stress. So, stress we can define as any demand for change, and the stress response is a cascade of physiologic events that can lead to improved health and productivity at times if we act on them and they are a positive for us, or anxiety, depression, obesity, immune dysfunction, and poor health outcomes. And one has to learn to recognize maladaptive stress responses and transform them into responses that improve health and well being. Some stress management tools that we will list here, and that's for the purpose that you can pick what you think may work for you, are breathing exercises, mindfulness, meditation, exercise like walks, yoga, etc., time in nature, removing negative, real or virtual stressors, managing expectations, both your own and those of others, relaxing activities, reading, music, dancing, etc., service to others, supporting relationships, gratitude practices, time for hobbies, play, and fun, and then time out. So, stepping away, like taking a break from tense interactions when they're not productive anymore, or periods of switching off work, mini vacations or staycations, favorite spots or places of refuge. From this list, I'm going to point out a few that are most helpful for me, as well as what I think is really helpful for leaders. One of them is breathing and mindfulness. Breathing can be a great relaxation or timeout, just even taking 3 deep breaths to reset, or longer if you can. Our breath is always available to ground us, and it works by diverting attention and giving time for the prefrontal cortex to get involved and activating the parasympathetic relax and connect system. So, simple variations can be just breathing, or the 1 to 2 ratio, that is, the expiration is twice as long as the inspiration, or a little more advanced is the 4-7-8, where the inspiration is to the count of 4, then you hold your breath to the count of 7, and you breathe out to the count of 8. Another relaxing technique is mindfulness. This helps to slow down, to pay full attention to whatever's in front of us, and live in the moment, really accept the moment as it is, rather than struggle with it and try to change it for what we want it to be in our head. This can include mindful breathing, as we've talked about, walking, listening, eating, pretty much any activity that relaxes you. And outcomes include acceptance of the moment and developing compassion for yourself and others. Another great tool for leaders to manage stress and to build emotional intelligence is building a meditation practice. And it's easy to get started in this day and age. You can use an app. I use 10% Happier, or there's others. You can sign up for a beginner's course. The University of Massachusetts runs an amazing course on mindfulness based stress reduction that anyone can take online. Ideally, you want to take out at least 10 to 20 minutes daily at a set time. And you want to give it at least 6 weeks. Some people say up to 6 months, but at least 6 weeks because that's the time that's been shown for habits to develop. And in 6 weeks, people started to show epigenetic changes after building a meditation practice. Outcomes from this include a much deeper understanding of oneself, awareness of our drives, values, purposes, strengths, weaknesses, relation to others, and a sense of balance and stillness, and a deeper connection to others, so empathy at all levels, cognitive, emotional, and compassion that is grounded in love. The last pillar is substance use, which includes no nicotine use, no recreational drugs, and either no alcohol use or within safe daily and weekly limits. An important point to pause here and acknowledge is that the underlying cause here is addiction. So, this is a chronic disease characterized by compulsive or uncontrollable use of a substance or behavior despite harmful consequences. And this needs counseling and professional care for it to be addressed completely. The presence of an addiction or risky use doubles the risk of overdose, motor vehicle crashes, traumatic injuries, and chronic conditions. So, after listening to the why and the what of lifestyle medicine, are you ready for change? Or the question might be, in what stage of change are you? Maybe you were not even thinking about it and were in the pre contemplation stage for some things and have entered the contemplation stage. Maybe you're beyond that and are preparing to act, or you've already been acting on it and now are figuring out how to refine that. If you're doing well on some fronts, you may want to celebrate that and see if you're ready to be in a maintenance phase and to prevent relapse from happening so that you don't fall back on the old patterns. This is a lifestyle medicine prescription, again developed by the American College of Lifestyle Medicine. And on the left are listed the 6 pillars. And on the right are some of the basic tips that we've gone through by now. And what you want to do is you want to pick a pillar or two. Maybe it's the one you feel most confident you can begin on a positive note on, or it's the one you think is going to be the highest yield for you. You pick. And then you want to consider developing a goal. And once you've written anything down, you want to make it a SMART goal, something that's specific, measurable, actionable, realistic, and time sensitive. One of the things to think about is how to make change happen. This model developed by James Clear on behavior change is very helpful to go through. So, a lot of times we start by focusing on the outcome that we want, so that's achieving, and that may be something that's helpful to some people or may have worked at some time, but it's really difficult if we just focus all the time on the outcome, because with every little step that may go wrong, then we go towards this whole sidetrack of shame, guilt, failure, and the outcome not happening. What is better is to focus on the process or what we're going to do to lead to this outcome, just like we were focusing on developing those SMART goals in our previous slide. An even more effective way is to think about linking this change to our identity. So, not just the achieving or doing, but the being. So, we want to be a better leader. So, we want to be there to care for our loved ones. And that's the identity, and the little decisions that we're going to make, the process that we're going to execute, is all coming from this place of identity. How to make change stick. So we can learn from the operant conditioning model here, which is based on how we respond to external stimuli, which is the cycle of cue, craving, response, and reward. And again, this is from James Clear's Atomic Habits book. And the way to make something work really well and stick is to make it obvious, make it attractive, make it easy, and make it satisfying. So if I wanted to develop a habit of walking or running first thing in the morning to get exercise and sunlight, then I want to make my running shoes and my running gear obvious. So take it out at night and I see it the first thing when I wake up. I want to make it attractive. So this is the time to like get the comfy shoes, a dedicated pair, things that I'm looking forward to, the place that will make it, really attractive. Make it easy. So make it weatherproof or dress up so that you don't have to ever worry about the weather. However is easier. If the timing is too long and that's becoming a barrier, shrink it down to whatever's the minimum amount of time that makes it appear easy. Maybe it's just 5 minutes to begin with. That's great because the only bad exercise is the one that never happened. And then finally, make it satisfying. So you can tie it to a reward. So I might have my hot cup of tea or coffee right after I am done with my exercise. So I'm giving myself a reward for doing this every day. A concept to refresh here is that of adaptive leadership. Adaptation is change that enables the capacity to thrive, and it preserves what is essential, it discards what is not necessary, and creates new arrangements that give the ability to flourish. One of the things to think about is identifying technical versus adaptive challenges in this problem of lifestyle change. And the technical part is what is already known and needs execution, and we've talked plenty about this. Whereas the adaptive part is what is not yet known and demands change. So you can reflect on what areas of life you are adapting in currently and thinking about what identity and behavior change needs to happen. You may have to reset some goals, expectations, routines, behaviors. Maybe it's managing stress. Maybe it's changing eating patterns. Maybe it's building in time for activity at the expense of something else that you're doing, or sleeping earlier, having to give up something that you may have done if you stayed awake. Whatever's coming in the way of your thriving and living your best life. You will need to adapt yourself, and I mean including your identity, which is going to evolve, and your behaviors, which are going to change. And have a growth mindset as you implement change. Every little step that you take may either lead to success or it may be something that teaches you something and you come back at the problem with a better mindset the next time, having learned from your previous experiment. And be a leader. So be the change you wish to see in the world. Role model and support others in taking care of their health and well-being. We're going to end with this quote from Ron Heifetz from The Practice of Adaptive Leadership. Take care of yourself, not as an indulgence, but to help ensure that the purposes you are seeking to forward have the best chance of being achieved, and that you are still around to enjoy the fruits of your labors. With that, cheers to your well-being and success.